Hi, this is Bruce Kelly from Fitness Together in Media, Pennsylvania. We are http://fitnesstogether.com/media on the web. You can link to our Facebook, our Twitter, YouTube, our email newsletter, as well as our blog through that website. Today we're going to talk about low back pain, biomechanics involved with that, as presented by Dr. Jeff Anderson at the Perform Better Summit in Providence. So a couple of things lead to the epidemic of low back pain. 85% of people will suffer low back issues at one time or another in their life. And according to the NIH, 85% of those 50 and older will have osteoarthritis or degenerative disc disease by the time they're 50. So that's a huge problem going forward, because there's only going to be more baby boomers falling into that category. Currently, low back pain and all the treatments involved with that is an $85 billion industry, huge industry, treating, trying to cure, surgery, preventative measures, etc., etc. So big dollars. Next to upper respiratory issues, low back pain is the second most common problem that people go to visit their doctor about. So it is prevalent. It affects over 3/4 of the people in this country. Big issue. And a lot of the issue is biomechanical, which means it's preventative. It's lifestyle related. A couple of clues from clinical observations that clinicians are clued into is that if you turn and look at somebody sideways, they have no butt. Their pants just drop straight down. This is especially the case with men. They have no butts, no junk in the trunk. So we are bipedal. Our butts, our glutes are the most powerful muscle in the body. They are what push us forward. Without them, we don't function well. And also, as a consequence of those no butts, they have flat low back. So those two are usually correlated. Those are clinical observations, or if you do a quick look at somebody, you're going to see that if they have no butt and a flat back, problem is, or chances are, they're going to have low back issues. So what's happened is, because we sit so much, we have created what's called a posterior pelvic tilt, which means essentially our pelvis has rolled under our upper body and puts strain on the soft tissues, discs, and musculature involved therein, or attached, everything attached to the pelvis. So because we sit so much, there are several causes or symptoms as a result of that. Creep, which is the concept of, because you assume a posture for a certain period of time, soft tissues, muscles, etc. tend to assume those lengthened positions on one side and shortened positions on another, because you tend to adapt to that posture. You also get a mechanical disturbance, i.e. you can't control and stabilize your low back and pelvis very well. Third, you get what's called gluteal amnesia, which means you can't function or use your glutes very well. They essentially have lost the connection between the central nervous system, i.e. the brain, and your glutes. And that's not good, because we end up with that pelvic tilt, posterior pelvic tilt, pulling ourselves along in gait instead of pushing, which is what the glute muscles are intended to do. So biomechanical means it's preventative. It's not a foregone conclusion, if you do the right things, that you're going to have low back pain, or if you've had it, that you can't prevent it in the future. You've got to improve your mechanics. You've got to strengthen the appropriate musculature, especially the glutes and other muscles attached to the pelvis. Have to avoid certain movements. Flexion, we already do so much flexion. Doing more stretching and strengthening exercises like crunches probably isn't a good idea, because that's just more flexion. So those are some tips that will help you in improving your biomechanics of your pelvis area or lumbopelvic complex, which hopefully will help you with any low back issues you have. So until next time, this is Bruce Kelly, Fitness Together Media. Train hard, train smart.